I'm Dr. Gerald Rogan. I'm a family doctor, ER doctor, and was a Medicare director in California, the author of the conceiver and then the author of the report on the Reading Medical Center disaster that Dr. Sabat and I and Dr. Grady wrote together. I speak for Dr. Sabat today along with myself. Dr. Grady you heard from before. And I can answer a couple of questions that you asked earlier if you want me to. That's separate from my testimony. But
yeah, if we have your testimony already.
Yeah, I wrote out my testimony, so I don't have to. Maybe I don't have to repeat the whole thing.
Yeah.
Since you have it and you want to get going.
Yes, yes.
So
I think what I asked earlier. How was 600 cases of surgery not a sign out there for whomever paid for these things?
Okay, well, I was the medical director for Part B Medicare for California, Northern California, NHIC. We spent about $1.5 billion a year on healthcare. And I saw Dr. Moon's data. I was the one that found it. Mm-hmm. And he was the highest paid cardiologist in all of California, over $1 million a year Medicare only, just for Medicare, not including what Blue Shield paid him and Anthem, Blue Cross, and other health plans. So I had him reviewed. And we didn't find the problem. And that's why I wrote the report. That's one of the reasons I decided to write this report. So the reason we didn't find him was because we didn't believe, I couldn't conceive as the medical director that someone would operate on normal patients. I just never thought doctors would stoop to that depth. Mm. You know, he beats out the Illinois governor. So it never occurred to us that he actually, all these services were unnecessary. We just validated that he actually did it. And he did do it. So he didn't pay any money back. So the Medicare program does not really assess quality. It just pays claims and makes sure people aren't lying about what they do, but we don't really assess quality. So that's your first answer. Medicare doesn't assess quality. And as far as the other plans are concerned, I was told by the Blue Shield director they just bailed out of Reading because of all the heart surgery and they didn't do anything to stop it. So, I mean, so you want to know why it went on. And then Tenet Hospital, as you heard from Dr. Grady, Tenet Hospital with some high-level cooperation from certain people at the top levels of the medical staff who allegedly were being paid, kept quiet and kept immune and including setting up this elaborate structure that you heard about with the Northern California Quality Review Team. So he was able to keep himself out. So L&C, licensing certification that you just heard from, they knew in 1999 that Reading Medical Center was not compliant with the requirements of state and federal laws to do peer review. CMS also knew. The regional office Medicare I worked for, they knew. They, in fact, wrote a letter to the CEO of Reading Medical Center and saying, you cannot assure patient safety in your hospital. And the words patient safety, cannot assure patient safety, was in the letter. I saw a copy. I got it from the state L&C files on a FOIA. So the state knew that. The state went back 4 times on resurveys, 3 initial survey and 3 other times. They knew in 1999 that Reading Medical Center did not comply with the federal or state requirements to do peer review. And they did nothing about it. They dropped the ball. They let them go and did nothing for 3 years while several more hundreds of patients were damaged until the FBI finally did the peer review. Now, to the state's credit, the state didn't know, L&C didn't know that Moon was recommending operations on normal patients because, as you just heard, they didn't see the files. All they knew was the process wasn't being done. And today, that's the same thing. So I looked on the L&C's website to see how many $25,000 penalties were assessed against hospitals for failure to do peer review. Last night, in the 8 most populous counties of California, there are 0 over the last 2 years, none. So the state of California, L&C, $25,000 fine for failure to do peer review is never applied. At least not in 8 most populous counties. So one of my first recommendations is that somebody needs to audit the peer review to see if it's effective. And if it's not effective, you need to have a penalty that actually has teeth. And the only penalty I could think of is to de-license the department for all elective surgery. Not for emergency, but all elective surgery. So the state doesn't have that power. L&C can't come in and say, you were closing down your cardiac surgery and cardiovascular lab until you do peer review. They don't have that power, but they need that power. Secondly, you heard from L&C that if they report the case to Medicare, that Medicare will cut off their provider number. That's false. Medicare never cuts off the provider number, except when the case is so bad that the hospital has to be kicked out of Medicare. And that's only occurred twice. Martin Luther King was kicked out, and Reading Medical Center was kicked out. And that took 4 years of Martin Luther King. CMS has a nuclear weapon to fight against absent peer review. They can kick the hospital out of the program, and that's it. And that's the whole hospital. So CMS and the state need to have intermediary penalties. So when they find a hospital is negligent and on re-review refuses to do what's necessary, I mean the medical staff or the hospital or both, when they refuse, they need to cut off the money. You cut off the money to the hospital and you cut off the money to the doctors. And they either do the peer review or they go out of business. And I'll bet, that's my recommendation number one. Number two recommendation, so you need intermediary penalties. That's in our report. Number two, you need to have regional peer review, but not as a replacement, but as an adjunct, okay? And there are three purposes of that. There are three things that we'll do, and those are in my report. But one is to assure that the peer review is done. Second, which the state can probably find if they look. And second is to assure that it's done effectively, that it's not being swept under the rug. In Reading, if Moon was doing self-administered peer review if he did it. He didn't do it, but if he had to have done it, he would have done self-administered peer review and find no problem. The second thing, so you need outside peer review to actually do it. You also need it in case to measure effectiveness. And then the third thing you need to do is to have outside peer review to assure due process when a doctor can't get a fair shake at his own hospital. And you've heard about sham peer review. So it actually serves three purposes. And the outside peer review, but will not replace a lot of the stuff you heard today, you know, the QA, the total quality management, the doctors who agree and they learn and they move on. All that stuff's working great. You know, we only wish that every hospital in the whole state was like Cedars-Sinai. But, you know, all that's working great. So you need an outside peer review process, and it could be set up maybe with a joint, after listening all day long, maybe it could be with the state, L&C, and the medical board in combination, because there's two penalties. The medical staff of the hospital actually does the peer review, and the hospital has to make sure it happens. So what you saw in Reading was the medical staff wouldn't do it, at least the guys in charge, and the hospital helped them not do it. So you've got a conspiracy here. So to break the conspiracy, you've got to have penalties against both sides, and that's why a combination of medical board and L&C to have regional peer review to fit all the three reasons I have in my paper would be a way to go.
Okay, let me ask you this.
And by the way, I didn't say I have no conflicts of interest. I don't practice at a hospital, and I wrote that report because it was the worst case of despicable doctor behavior I saw in my whole time at Medicare in 6 years.